81. In the care of a cardiac arrest patient, epinephrine is used to A. Decrease the container size to increase BP. B. Increase ventricular fibrillation amplitude. C. Prevent anaphylaxis from lidocaine reactions. D. Increase the effects of the other drugs. Answer. B. Epinephrine is used to coarsen dysrhythmia such as ventricular fibrillation, improving the chance of converting to a more viable rhythm. 82. A patient's signs and symptoms include orthopnea, spasmodic coughing, agitation, cyanosis, rales, jugular vein distension, and elevated blood pressure, pulse, and respirations. What condition should you suspect? A. Left heart failure. B. Right heart failure. C. Myocardial infarction. D. Cardiogenic shock. Answer. A. Listed are classic signs and symptoms of left heart failure with pulmonary edema. 83. Your patient is exhibiting the signs and symptoms of right-sided heart failure. There is no evidence of left-sided failure. In addition to ECG monitoring and high-flow oxygen, what additional treatments should he or she receive? Answer. C. Right heart failure, unless it is accompanied by left heart failure with pulmonary edema, is not a true medical emergency and does not require rapid transport. 84. What is sodium nitroprusside, nipride, used in the treatment of A. Deep venous thrombosis. B. Myocardial infarction. C. Hypertensive emergency. D. Cardiogenic shock. Answer. C. Sodium nitroprusside is used in the treatment of hypertensive emergency. 85. Which of the following drugs is an antidysrhythmic agent? A. Furosemide. B. Lidocaine. C. Nitroglycerin. D. Isoproterenol. Answer. B. Lidocaine is a first-line drug in the treatment of dysrhythmias. 86. In performing emergency synchronized cardioversion, you would synchronize the electrical shock with which of the following waveforms? A. P wave. B. R wave. C. PR interval. D. QRS complex. Answer. B. Emergency synchronized cardioversion is synchronized with the R wave in order to avoid firing during the relative refractory period, which could induce ventricular tachycardia. 87. The P wave on an ECG strip reflects what event inside the heart? A. Atrial depolarization. B. Atrial repolarization. C. Ventricular depolarization. D. Ventricular repolarization. Answer. A. The P wave reflects atrial depolarization at the beginning of the cardiac cycle. 88. What does treatment for a patient who is experiencing stable angina consist of? A. Oxygen and defibrillation if the QRS complex is wide. B. Rest, oxygen, and nitroglycerin administration. C. Reassurance, oxygen ECG monitoring, and morphine sulfate. D. Seating patient upright and starting for ECG and furosemide. Answer. B. The correct protocol for stable angina is rest, oxygen, and nitroglycerin. 89. The wheezing associated with left-sided heart failure results from A. Fluid in the lungs. B. Chronic bronchitis. C. Chest muscle tightness. D. Chest wall expansion. Answer. A. The wheezing, due to bronchoconstriction of smooth muscle in the lung, is a reaction to fluid in the lung spaces. 90. A patient is found in a back bedroom lying supine on the bed with a hunting knife embedded in her anterior chest, midline below the right breast. The patient is in obvious respiratory distress. She is cold, clammy, and diaphoretic with flat neck veins. You hear no breath sounds on the right side. This patient most likely is suffering from A. Pneumothorax. B. Pericardial tamponade. C. Tension pneumothorax. D. Hemothorax. Answer. D. Flat neck veins while the patient is supine indicate a lower than normal pressure inside the vasculature, most likely due to blood loss. This would indicate a hemothorax as the primary cause of the described signs and symptoms. 91. A primary reason for administering oxygen to a patient with AMI is to A. Help limit the infarct size. B. Prevent pulmonary edema. C. Reduce anxiety and fear. D. Treat ventricular dysrhythmias. Answer. A. Oxygen can help limit the size of the infarct by increasing oxygen delivery to the heart muscle. 92. Which of the following is the most appropriate treatment for an adult patient who has a head injury and is seizing? Answer. B. Diazepam given through the IM route is ineffective. Oral intubation may be difficult to achieve through clenched teeth. Nasal intubation may raise intracranial pressure even higher. 93. What is this patient most likely suffering from? A. Acute pulmonary edema. B. Nitrogen narcosis. C. Decompression sickness. D. Pulmonary embolism. Answer. D. A too rapid ascent from a scuba dive may result in a pulmonary embolism due to lung overinflation. 94. What does treatment for this patient consist of? Answer. B. N4, 100% oxygen via a non-rebreather mask and transport to a recompression chamber are essential for this patient. 95. Due to his rapid ascent, this patient may also be suffering from which other diving-related emergency? A. Nitrogen narcosis. B. Acute pulmonary edema. C. Decompression sickness. D. Pneumonia. Answer. C. Due to the depth of the dive and the rapid ascent, this patient may also be suffering from decompression sickness. 96. What is an additional possible problem associated with this injury? A. An increased level of carbon dioxide in the interstitial spaces. B. Nitrogen bubbles entering tissue spaces and smaller blood vessels. C. An increase in oxygen levels in the tracheobronchial tree. D. Excess accumulation of lactic acid collecting in the alveolar space. Answer. B. In this patient, nitrogen gas bubbles may have entered tissue spaces and blood vessels. 97. The normal gestational period is A. 50 weeks. B. 40 weeks. C. 30 weeks. D. 20 weeks. Answer. B. Full-term delivery usually occurs within the 40th week of pregnancy. 98. During delivery, a loop of umbilical cord presents from the birth canal. You should A. Cover the cord with a moist and sterile dressing. B. Have the mother stand to assist in delivery. C. Clamp the cord if possible and cut it. D. Reinsert the cord into the vaginal opening. Answer. A. Covering the exposed cord will minimize drying of the cord. Additionally, you should try to insert 2 fingers into the birth canal and try to keep pressure from the baby's head away from the cord. 99. For which of the following conditions would you be likely to receive an order to administer intravenous thiamine? A. In status epilepticus. B. In metabolic shock. C. Hyperventilation. D. Profound intoxication. Answer. D. Intravenous thiamine is used to reverse the effects of acute thiamine deficiency, which may lead to seizures and encephalopathy in alcoholics. 100. During delivery, you notice that the amniotic fluid is discolored and has a foul odor. What should you do first? A. Suction the upper airway using a meconium aspirator. B. Intubate the child and give positive pressure ventilations. C. Dry, warm, position, suction, and stimulate the child to breathe. D. Provide 5 back blows and then 5 chest thrusts. Answer. A. Suction the newborn before stimulating it to breathe. Endotracheal suctioning may be warranted if meconium is noted in the upper airway.